Abortion bans have delayed emergency medical care. In Georgia, experts say this mother's death was preventable. At least 2 women in Georgia die after they couldn't access legal abortions and timely medical care in their state, ProPublica has found. This is one of their stories. Amber Thurman, a 28-year-old mother, died after she couldn't access legal abortion care in Georgia. The state's Maternal Mortality Review Committee found that her death was preventable and said a delay in care had a large impact. In her final hours, Amber Nicole Thurman suffered from a grave infection that her suburban Atlanta hospital was well equipped to treat. She'd taken abortion pills and encountered a rare complication. She had not expelled all of the fetal tissue from her body. She showed up at Piedmont Henry Hospital in need of a routine procedure to clear it from her uterus, called a dilation and curettage, or DNC. Just that summer, her state had made performing the procedure a felony, with few exceptions. Any doctor who violated the new Georgia law could be prosecuted and face up to a decade in prison. Thurman waited in pain in a hospital bed, worried about what would happen to her 6-year-old son, as doctors monitored her infection spreading, her blood pressure sinking and her organs beginning to fail. It took 20 hours for doctors to finally operate. By then, it was too late. The otherwise healthy 28-year-old medical assistant, who had her sights set on nursing school, should not have died, an official state committee recently concluded. Tasked with examining pregnancy-related deaths to improve maternal health, the experts, including 10 doctors, deemed hers preventable and said the hospital's delay in performing the critical procedure had a large impact on her fatal outcome. Their reviews of individual patient cases are not made public. The ProPublica obtained reports that confirm that at least 2 women have already died after they couldn't access legal abortions and timely medical care in their state. There are almost certainly others. Thurman's case marks the first time an abortion-related death, officially deemed preventable, is coming to public light. ProPublica will share the story of the second in the coming days. We are also exploring other deaths that have not yet been reviewed but appear to be connected to abortion bans. Doctors warn state legislators women would die if medical procedures sometimes needed to save lives became illegal. Though Republican lawmakers who voted for state bans on abortion say the laws have exceptions to protect the life of the mother, medical experts caution and that the language is not rooted in science and ignores the fast-moving realities of medicine. The most restrictive state laws, experts predicted, would pit doctors' fears of prosecution against their patients' health needs, requiring providers to make sure their patient was inarguably on the brink of death or facing irreversible harm when they intervene with procedures like DNC. They would feel the need to wait for a higher blood pressure, wait for a higher fever. Really got to justify this one. Bleed a little bit more. Dr. Melissa Kopke, an OB/GYN at Emory, warned lawmakers in 2019 during one of the hearings over Georgia's ban. Doctors and a nurse involved in Thurman's care declined to explain their thinking and did not respond to questions. The availability of DNCs for both abortions and routine miscarriage care helped save lives after the 1973 Supreme Court ruling in Roe v. Wade. Studies show reducing the rate of maternal deaths for women of color by up to 40% the first year after abortion became legal. But since abortion was banned or restricted in 22 states over the past 2 years, women in serious danger have been turned away from emergency rooms and told that they needed to be in more peril before doctors could help. Some have been forced to continue high-risk pregnancies that threaten their lives. Those whose pregnancies weren't even viable have been told they could return when they were crashing. Such stories have been at the center of the upcoming presidential election, during which the right to abortion is on the ballot in 10 states. The Republican legislators have rejected small efforts to expand and clarify health exceptions, even in Georgia, which has one of the nation's highest rates of maternal mortality and where Black women are 3 times more likely to die from pregnancy-related complications than white women. When its law went into effect in July 2022, Gov. Brian Kemp said he was overjoyed and believed the state had found an approach that would keep women safe, healthy and informed. After advocates tried to block the ban in court, arguing the law put women in danger, attorneys for the state of Georgia accused them of hyperbolic fear-mongering. 2 weeks later, Thurman was dead. She recalled her daughter's last words before she was wheeled into surgery. They had made no sense coming from a vibrant young woman who seemed to have her whole life ahead of her. "Promise me, you'll take care of my son."